And Amy, this is interesting perspective from our friends over in Israel. Israeli Defense Minister Naftali Bennett on what they believe is a key takeaway from the approach they've taken to combat the coronavirus outbreak in Israel.
Shalom. My name is Naftali Bennett, and I'm Minister of Defense of the State of Israel. I want to share with you the single most important insight of the entire corona epidemic. The most important thing, more than general social distancing, more than testing, more than anything else, is to separate old people from younger people. The single most lethal combination is when grandma hugs her grandson. Why is that? Because corona is a unique virus in the sense that it's way more lethal for old people than for young people. In many countries, zero young people died. Countries that many people died, you have 0% or 0.1% of folks under the age of 30 or 20, whereas old people over the age of 80 and 70, 1 out of 5, 1 out of 7 of them that get the virus die. So what we need to do over the next period of time is take care of grandma and grandpa, but from far away. Lots of WhatsApps and Skype and you name it. Bring them food, clean the box before you leave, and then they take it in their house.
And you get the picture. This is sort of a more serious version of Mel and Max Brooks talking to each other through the glass door window.
Oh, it was cute.
The only thing is, I think it's a little bit more complicated than that, just separating older people from younger people. One is you don't necessarily stop the spread because it can still spread among younger people. And the whole point is we're separating the elderly so that we can quell the spread. But then if you aren't, I guess, you ostensibly would be practicing social distancing too among the young people, and so that ultimately you'd flatten the curve, and then you'd have at least some percentage of elderly people, the more vulnerable population, salted away so that they don't join in those infected during this period of social distancing. And in this country, of course, we're 1 week into the 15-day guidelines that were issued last week by the federal government. The other is that you've got to. I mean, if it's about returning people back to work, you've got a lot more older people that are working now.
Right.
And so, what's the threshold? And what are the parameters that one would meet before they would be essentially deemed to have to isolate? I don't know. I mean, I take his point, and Israel has got about as many cases as we do in Illinois, and they're about 2/3 of our population, fewer deaths at this point. So there's some common sense to what Secretary Bennett or Minister Bennett is saying, but I don't know that that's a fail-safe. For more on the topic, let's do another comparison. How about Illinois versus Wisconsin and some of the proposals emanating from our respective state leadership? Pleased to be joined by Will Flanders. He is a PhD. He's research director at the Wisconsin Institute for Law and Liberty. Will, thanks so much for joining us. Appreciate it.
Good morning. Thanks for having me on.
So on Friday, when our governor was announcing a lockdown, Tony Evers, the Democrat governor of Wisconsin, along with Republican leaders in the state legislature, they agreed to take the opposite approach and not take that next step into a lockdown.
That's right, and we have a lot of disagreements with the governor on a lot of different topics, but I think on this topic we've all been very appreciative. The Republican leadership in the Assembly and the Senate basically put out a press release praising the governor. I think we're agreeing in that assessment. What we're trying to do here is do the smart things. You just talked about the social distancing, doing the social distancing, but we're all worried about our businesses. We're all worried about our small businesses and the effect that this is going to have long term on employment. So to the extent that we can avoid going quite as far as was done in Illinois, I think that's a good thing. I think what we'll have to see is if people follow through on what we're asking of them, right? If people are in fact engaging in these practices, then maybe we don't have to take that next step. And I do appreciate the governor here for giving a little more time before going to that level.
Well, are hair salons open there? Are gyms open there? Are theaters open there? Are restaurants? What's life like in
So,
Wisconsin? Tell us.
so currently, what we have is that no gatherings of over 10 people. So, I was in a store this weekend, and they were actually counting the people that were in there. And when there was 10 people in the store, they weren't allowing anyone else to come in the door. They had to stand outside. So it's still draconian measures. It's still pretty severe. Restaurants are on takeout only. It's not as if things are going on. It's completely normal up here. There's a lot of steps that have been taken to try to quell the spread.
And the reaction you're getting from colleagues and cheeseheads, people understand, and they're supportive of the restraint that both Democrat Governor Evers and Republican legislators have had. I
think so. It's hard to get a full assessment, obviously, of what people are thinking. Obviously, they're people that are still. It surprises me the number of people that are still in the camp of maybe this isn't a problem. That does continually surprise me. I had someone the other day ask, is this even a legitimate illness? You still have those folks out there, and a larger percentage than you might think that think this is nothing to really worry about. It's just a bad flu. And I think some of the early rhetoric and some of the early stuff on both sides that sort of dismissed the severity of this has sort of continued to have an impact even to this point. But I think overall there's a pretty good sense of consensus here that we're trying to avoid the most draconian measures, but we're hoping that folks can do the right thing. And it seems to me, anecdotally, that a lot of people are.
You got 381 cases, at least the last stats I see looking at the state-by-state breakout. 381 cases and a couple of deaths.
That's right. That's the numbers I've seen as well. That's correct.
Mm-hmm. There's a push from some quarters to expand Medicaid as a response, as one of the sort of quasi-health/financial responses to the outbreak. And you suggest that there's no reason for that. Explain.
Yeah, that's right. So the Senate Majority Leader or Minority Leader Jennifer Schilling, a Democrat, put out there on Twitter last week that this is an example of why Wisconsin needs to have expanded Medicaid. And I think our state is in a pretty unique situation relative to the 13 other states out there that have not expanded Medicaid, in that we have no coverage gap. So up to 100% of the federal poverty line, everyone is eligible for Medicaid in Wisconsin. That's not the case in some of the other states that haven't expanded. Above that, people are eligible for heavily subsidized plans on the Obamacare exchange. So, if you are right above those thresholds, your policy might be as cheap as literally a couple of dollars a month. There are many policies on there that are at that level. So my argument is that, while we're finding areas of agreement and consensus on the social distancing, let's not enact a policy that we're going to find detrimental later on. Just in this case of panic in the situation, to institute a policy that's actually not going to have a beneficial impact in the long term.
Well, not to mention highest best use of scarce tax dollars, right? And rather than into the Medicaid system, which you're effectively 50-50 with the federal government, how about directly to help keep people employed and businesses' doors open when we get through this?
That's absolutely right. So there are better uses of taxpayer money, I think, than going the Medicaid expansion route. The governor here made this his number one priority when he was elected. He explicitly said this is where he wants to go more than anything else. During the last legislative session, Republicans successfully fought against it, and I think the fear now is that when we come back next year, the coronavirus outbreak is going to sort of push people across the threshold. But there's really no evidence that Medicaid expansion would have any significant impact, particularly given that most private insurers are covering the tests at no cost. And there's a lot of movement from private insurers to ensure that folks are getting the care they need in these cases.
One of the other things, I was just talking to a friend of mine who's a doctor, is a dermatologist. All this emphasis, and President Trump emphasized again last night on telehealth. That's great, and the expansion of telehealth under Medicare is great. Medicare, not Medicaid now. But it also has its limitations. I mean, there's only so much you can do when it comes to telehealth in terms of diagnosing and treating, and particularly as we have people suffering from other conditions beyond coronavirus who still need treatment in these times.
That's right. I think among some particularly on the right, but across the spectrum, there's this idea that telehealth is the ultimate solution. That it's that's going to save our healthcare system. I think it's an important tool in the toolbox. I think in many cases it can be useful, but we shouldn't pretend that it's going to be this sort of panacea that's going to solve all of our healthcare issues. There are many things that, in fact, doctors still need to see someone in person for. So yes, it's a great tool in the toolbox, but we shouldn't ever pretend that it's some ultimate thing that's going to solve many of our healthcare problems.
He is Will Flanders, Research Director at the Wisconsin Institute for Law and Liberty. Will, thanks for joining us. Good luck up there in Cheeseland.
Thank you so much. Have a good day.
Thank you. And he joined us on our turnkey.pro answer line.